I want you to do something very simple right now. Swallow once, just once. Now pay attention to the back of your throat. Do you feel something there? A layer, a thickness, a sticky coating that seems to stay no matter how many times you clear your throat? Maybe you noticed it this morning. Maybe you notice it every morning. Or maybe it follows you all day, quietly annoying you while you talk, eat, sleep, or try to relax. And if I asked you when it started, you might not even know. That is very common. For many adults over 55, persistent throat mucus does not appear overnight. It creeps in slowly. At first, maybe it is only there in the morning. Then it happens after meals. Then you start carrying water everywhere. You clear your throat before speaking. You avoid certain foods. You try honey, tea, lemon lozenges, steam, and every home remedy someone recommends. But the mucus keeps coming back. So let me say something important. That mucus is not random. Your body does not create symptoms for no reason. Persistent throat mucus is usually your body trying to tell you that something underneath needs attention. And the problem is this: many people treat the mucus itself, but they never ask why the mucus is being produced in the first place. They are told, drink more water. They are given throat lozenges. They are told, it is probably just aging. And sometimes they are dismissed completely. But in many cases, the real cause is still active in the background. Today, I want to help you understand what may actually be happening. We are going to talk about 5 common research-supported causes of persistent throat mucus in adults over 55, and I will also explain why 2 of these causes often work together, making the problem feel much worse than it should. Welcome back to Health 360 Days. I am speaking to you today as a medical educator, focused on prevention, healthy aging, and practical steps you can actually use in daily life. Before we go further, tell me in the comments, is your throat mucus worse in the morning or does it stay with you all day? Write morning or all day below. That one answer can give us an important clue about what may be driving your symptoms. Now let us begin with something most people are never properly taught. Mucus itself is not bad. In fact, your body produces mucus every single day, all day long. That is normal. That is healthy. Mucus protects your airways. It traps dust, bacteria, viruses, smoke particles, and irritants before they can travel deeper into your lungs. It also keeps the delicate lining of your throat and airway moist. Without mucus, those tissues would dry out, crack, become irritated, and become more vulnerable to infection. So mucus is not the enemy. The real issue is when mucus becomes too thick, too excessive, or too slow to clear. Inside your airways, there is a natural cleaning system called mucociliary clearance. Your airway lining contains tiny hair-like structures called cilia. These cilia move rhythmically, sweeping mucus upward and outward so it does not sit and build up. When you are younger, this system tends to work quickly and efficiently. Mucus is produced, moved, and cleared before you even notice it, but as we age, this system can become less efficient. The cilia may move more slowly, the mucus may stay in place longer, and anything that increases mucus production can become much more noticeable. That means the same irritation that a 35-year-old barely notices may become a daily problem for someone who is 65, 70, or older. This is not your imagination, and it is not simply getting old. It is physiology. Once you understand that, the next question becomes, what is irritating the throat or airway enough to create all this mucus? Because number 1 is one of the most commonly missed causes of persistent throat mucus in older adults. It is called laryngopharyngeal reflux, or LPR. You may know regular acid reflux as heartburn, that burning feeling in the chest after eating too much, eating too late, or lying down after a heavy meal. But LPR is different. It is often called silent reflux because many people do not feel heartburn at all. No burning chest, no obvious stomach pain, no clear digestive warning sign. Instead, the symptoms appear in the throat. A constant need to clear the throat, a rough morning voice, a feeling of mucus sitting behind the throat, a sensation of something stuck there, a cough that is worse after lying down, or mucus that is worst first thing in the morning. Here is what happens. Between your stomach and your esophagus, there is a muscular valve. Its job is to close after you eat and keep stomach acid where it belongs. But with age, weight changes, certain foods, medications, and lifestyle habits, that valve may not close as tightly as it once did. When that happens, small amounts of acid can move upward. Sometimes that acid reaches the throat, voice box, or even the back of the nose. And the throat is not designed to handle acid. Even a tiny amount of acid exposure can irritate the throat lining. Your body responds by creating thick protective mucus to coat the area. That response makes sense biologically. Your body is trying to protect you. But if this happens night after night while you sleep, you may wake up every morning with mucus, throat clearing, hoarseness, or that heavy coated feeling. And because you never felt heartburn, you may never connect the problem to your stomach. Ask yourself these questions. Is your throat worse in the morning? Does your voice sound rough when you wake up? Does the mucus get worse after late meals? Does it worsen when you bend forward? Do you often clear your throat after eating? If yes, silent reflux may be part of the picture. Another important point, some common pain medications such as ibuprofen or naproxen can irritate the stomach or reduce the stomach's natural protective barrier in some people. If you take these medications often for joint pain or arthritis and your throat mucus has become persistent, bring that connection up with your doctor. Do not stop prescribed medication on your own, but do ask the right questions. Before we continue, take a moment and write your name and where you are watching from. I truly want to know who is part of this community, and your comment may help someone else feel less alone. Cause number 2 is post-nasal drip from chronic sinus inflammation. When people hear sinus problem, they often imagine severe facial pain, a blocked nose, pressure around the eyes, thick yellow discharge, or a classic sinus infection. But in many adults over 55, sinus inflammation can be much quieter. You may breathe fairly normally, you may not have a major headache, you may not feel sick, but your sinuses may still be mildly inflamed and producing extra mucus. That mucus slowly drains down the back of your throat throughout the day. That is post-nasal drip, and it can create the feeling of mucus sitting in the throat, especially when lying down, waking up, or speaking for a long time. This is one reason many people say, I keep clearing my throat, but nothing really comes out. The mucus may not be coming from the throat at all. It may be draining from the nose and sinuses. Many people try antihistamines because they assume it must be allergies. Sometimes that helps, especially if allergies are involved. But in other cases, antihistamines dry the mucus without fixing the underlying inflammation. And dry, sticky mucus can feel even worse. One of the most practical tools for post-nasal drip is saline nasal rinsing. A properly prepared warm saline rinse can help remove mucus, reduce irritants, support nasal moisture, and improve the natural clearance system. The key is consistency. Using a rinse once or twice may give short-term relief, but using it correctly every day for 1 or 2 weeks is when many people begin to notice a real difference. Later in this video, I will give you a simple action plan for how to do that safely. If this is helping you so far, type 2 in the comments. And if you want more practical health guidance for adults over 50, subscribe to Health 360 Days and turn on the notification bell. Cause number 3 may surprise you. Your medication could be part of the problem. There is a class of blood pressure medications called ACE inhibitors. These medications are commonly prescribed and can be very effective for controlling blood pressure, but they have a known side effect in some people: throat irritation, dry cough, or a constant urge to clear the throat. This happens because ACE inhibitors can allow a substance called bradykinin to build up in the body. In some people, that can irritate the airway and throat. The frustrating part is that this side effect may not start immediately. It can appear weeks or even months after beginning the medication, so a person may start a blood pressure pill, feel fine at first, and only later develop throat clearing or coughing. Because of the delay, they never connect the two. If you take blood pressure medication and you are unsure whether it is an ACE inhibitor, ask your pharmacist or doctor. They can tell you quickly. Common ACE inhibitor names often end in pril, such as lisinopril, enalapril, ramipril, or benazepril. Do not stop taking blood pressure medication without medical guidance. High blood pressure can be dangerous when untreated, but if your symptoms began after starting or changing medication, it is worth discussing. There are other medication classes, such as ARBs, that may be appropriate for some patients and do not usually cause the same throat clearing side effect. This is why your timeline matters. Write down when your throat symptoms started. Write down when you started or changed medications. Bring that list to your doctor. That simple timeline may reveal a connection you have been missing for months. If you are still watching, type clarity in the comments because that is what this video is about, helping you understand your body more clearly. Because number 4 is dehydration, but not in the simple way most people think. Your mucus is mostly water. When your body is well hydrated, mucus tends to stay thinner and easier to move. When you are dehydrated, mucus can become thicker, stickier, and harder to clear. Think about syrup. Fresh syrup flows easily, but if it sits open and loses moisture, it becomes thick and sticky. Mucus behaves in a similar way. Now here is the aging-related issue. Your thirst signal becomes less reliable as you get older. A younger adult may feel thirsty before dehydration becomes noticeable, but older adults may already be mildly dehydrated before they feel thirsty. That means you can have thick mucus, dry mouth, constipation, fatigue, or morning throat discomfort without ever thinking, "I need water." Waiting until you feel thirsty may mean you are already behind. This does not mean every person should force large amounts of water. People with heart failure, kidney disease, or certain medical conditions need individualized fluid advice from their doctor. But for many healthy adults, the goal is steady hydration throughout the day. Water counts, herbal tea counts, soup counts. Water-rich foods like cucumber, melon, oranges, and broth-based meals can help too. The important habit is not drinking a huge amount at night. The important habit is regular intake across the day. If this point applies to you, type 4 in the comments. And remember to subscribe because small daily habits like this can change how you feel more than you might expect. Because number 5 is often overlooked, the gut-airway connection. This may sound surprising, but your throat and lungs are not separate from the rest of your body. Your digestive system and respiratory system communicate through immune pathways, inflammatory signals, and the nervous system. Inside your intestines live trillions of bacteria known as the gut microbiome. When the microbiome is balanced, it helps regulate immune function and inflammation. But when that balance is disrupted, the immune system may become more reactive. In some people, that can contribute to inflammation in the airways and increased mucus production. This connection is sometimes called the gut-lung axis. What can disrupt the gut microbiome? A low-fiber diet, too much added sugar, repeated antibiotic use over the years, chronic stress, poor sleep, a lack of fermented foods, a diet low in plant variety. For some people, the throat mucus is not just a throat problem. It may be part of a larger inflammatory pattern in the body. You will not fix that with a lozenge. A lozenge may soothe the throat temporarily, but it will not rebuild the gut microbiome. That requires consistent daily choices over time. This does not mean you need an extreme diet. In fact, simple steps are often better. Add more fiber from vegetables, beans, oats, berries, lentils, and whole foods. Try small servings of fermented foods if you tolerate them, such as plain yogurt with live cultures, kefir, sauerkraut, or kimchi. Reduce excess sugar. And pay attention to digestion, bowel habits, bloating, and food patterns. Your throat may be responding to signals that began much lower in the body. Now, before we move into the action plan, I need to pause for something very important. Most persistent throat mucus in older adults is not dangerous. Most of the time, it is related to reflux, sinus drainage, medication effects, dehydration, irritation, or inflammation. But sometimes throat symptoms can be a warning sign that needs medical attention. Please make an appointment with your doctor promptly if you notice any of the following: mucus with blood, even a small amount. Trouble swallowing that is getting worse. Unexplained weight loss. A lump or swelling in the neck, a voice change that does not improve, pain that persists, shortness of breath, or symptoms that keep getting worse despite basic care. Do not ignore those signs. Do not try to manage them only with home remedies. Your body may be asking for a proper evaluation. Now let us turn all of this into a practical plan you can start using tonight. First, stop eating at least 3 hours before lying down. This is especially important if your mucus is worse in the morning. When you eat and then lie down, your stomach is still working. The valve between the stomach and esophagus has a harder job. Acid is more likely to move upward. A 3-hour gap gives your stomach time to empty and may reduce nighttime silent reflux. Second, elevate the head of your bed. Do not just stack pillows under your head. That can bend your neck and sometimes make breathing or throat discomfort worse. Instead, use a wedge pillow or elevate the head of the bed slightly under the mattress or bed legs. The goal is to use gravity to reduce reflux while you sleep. Third, drink warm water before bed and again in the morning. A glass of warm water before sleep can help support overnight hydration. In the morning, drink 1 or 2 glasses of warm water before coffee or breakfast. This can help loosen mucus that accumulated overnight and make the morning easier. Fourth, consider a daily saline nasal rinse. Use a neti pot or squeeze bottle from the pharmacy. Use sterile, distilled, or previously boiled and cooled water. Do not use untreated tap water. Mix with the proper saline packet or the correct amount of salt according to the device instructions. Use it gently once daily, preferably in the morning. Give it 2 full weeks before deciding whether it works for you. Consistency is what makes the difference. Fifth, review your medication list. Do not guess. Write down your medications and the dates you started or changed them. Ask your doctor or pharmacist whether any of them could be contributing to throat clearing, cough, reflux, dryness, or mucus. If you take a blood pressure medication, ask specifically whether it is an ACE inhibitor. Again, do not stop medication on your own. The goal is a safe conversation with your healthcare provider. Sixth, support your gut health gradually. Add 1 small serving of fermented food if it agrees with your body. Add more fiber-rich whole foods. Reduce excess sugar. Drink enough fluids. Prioritize sleep. This is not an overnight fix, but it can change your baseline inflammation over time. Seventh, keep hydration visible. Put water where you spend time. Near your chair, by your bed, in the kitchen, near your work area. Many people drink more simply because the water is easy to reach. Now let us talk about popular home remedies. Honey can be soothing. It can calm throat irritation temporarily. If you tolerate it and your doctor has not told you to avoid it, it may be helpful. But honey does not solve silent reflux, chronic sinus drainage, medication side effects, dehydration, or gut inflammation. Dairy does not create mucus from nothing. That is a common myth. However, some people feel that dairy makes existing mucus feel thicker. If you notice a consistent pattern, you can try reducing dairy for 2 to 3 weeks and see if your symptoms change. Apple cider vinegar is popular online, but be careful. If you have silent reflux, adding more acid may make throat irritation worse. It is not the right solution for everyone. Here is what I want you to remember, that mucus in the back of your throat has a reason. It may be silent reflux happening while you sleep. It may be post-nasal drip from low-grade sinus inflammation. It may be a medication side effect, especially from an ACE inhibitor. It may be chronic mild dehydration that you do not feel as thirst, or it may be connected to gut inflammation and microbiome imbalance. And very often, more than one cause is happening at the same time. For example, silent reflux and dehydration can work together. Acid irritates the throat, the body produces mucus, and dehydration makes that mucus thicker and harder to clear. Post-nasal drip and slow mucociliary clearance can also work together. Your sinuses produce extra drainage and your aging airway system clears it more slowly. That is why one small remedy often fails. The real solution is not just stop the mucus. The real solution is to reduce the reasons your body is producing and holding onto mucus in the first place. If someone told you, this is just part of getting older, I hope today gave you a better answer. You are not simply aging. You are dealing with specific body systems: reflux protection, sinus drainage, airway clearance, hydration, medication response, and immune balance. And when you understand those systems, you can take smarter steps. Start tonight with 3 simple actions. Finish eating 3 hours before bed. Drink warm water before sleeping and again in the morning. Elevate your upper body slightly while you sleep. Then, over the next 2 weeks, add saline nasal rinsing, review your medications, and begin supporting your gut health. Small steps done consistently can create real change. If this video helped you, please subscribe to Health 360 Days, like this video, and share it with someone who keeps clearing their throat but does not know why. That one share may help them stop blaming themselves and start understanding their body. And before you go, tell me in the comments, which of the 5 causes surprised you the most? Was it silent reflux, post-nasal drip, blood pressure medication, dehydration, or the gut-airway connection? Also tell me how long you have been dealing with throat mucus. I read your comments and your experience matters here. Thank you for watching Health 360 Days. Stay informed, stay consistent, and remember, your body is always communicating. The more you understand the message, the better you can care for yourself